Okay, my name is Jennifer, and I am going to be, I am in Lukowski's class, Adult Health 1, and I am going to be hanging a mini bag with Rosefin antibiotics. Okay, so what I'm going to do is I'm going to check the chart, which I have in front of me, to make sure that the patient doesn't have any allergies or anything like that. Make sure I know where I'm going, how much is being administered, what is being administered, and the side effects of those. I am going to be administering Rosefin 1 gram IV daily as directed. And it inhibits third and final stage of bacterial cell wall. The purpose is to treat and fight bacteria and treat infection. Like I said, 1 to 2 grams once daily. The side effects to look for would be the GI, fevers, pseudomembranous colitis, excuse me with that. The contraindications will be allergies to ceftin, penicillin if they already have hepatic or renal disease, anaphylactic, or pregnancy and breastfeeding. Also assess the bond and creatinine. The labs with that, the bond is 7 to 23 at a normal range, and the patient is at 10. The creatinine is 0 to 6 to 1.2, and they're currently at 1. The how many drops I would be administering per minute would be 17 drops. And this is my drug card that I'm using with everything on there. Okay, so now what I'm going to do is I am going to administer the medication into the 50 mLs of normal saline. Okay, and what I'm going to do is I'm going to wipe the top of the Rosefin off. And it's going to be 2 mLs that I'm administering. When I did my calculation, that's what I came out with, so it's 2 mLs. So what I'm going to do is drop 2 mLs of air. Okay, and push the air in. And what I'm going to do is pull out 2 mLs of Rosefin.
Penicillins or cephalosporins, it can cause some adverse reactions of Stevens-Jones syndrome.
And then I'm going to recap, making sure to do the scoop method so that I do not puncture myself. And I am going to draw up the 6 mLs of normal saline that I'm going to need later in order to do my flushes.
The recommended dose is 1 gram to 2 grams daily. So like I said,
push the air in.
1 gram, 10,000 milligrams.
6
and what we have on hand is Rosefin 500 milligrams per ml. So we get the dose that you need to draw up in here. It's going to be 1,000 divided by 500 times 1, which equals 2 ml. And to calculate the drop factor,
make sure we have enough.
How many mLs are in the bag that we're handling, which is 50 mLs.
Okay. And that is the 6 ml. So what I'm going to do is I'm going to rescoop this, and I'm going to take this off. Okay, if I can get this off. Okay, take that off. And then what I'm going to do is I'm going to scrub this while I administer the Rosefin. Make sure not to puncture myself. Okay. Making sure to rescoop.
And I have my 10 ml syringe.
And what I'm going to do is I'm going to shake this up, mix this, and we have that prepared. And I'm going to dispose of these in the sharps containers. Okay, so now I have everything that I need. I'm going to take my doctor's order and I'm going into the room. Before I do that, I'm sorry, I have to prime my tubing, which is right to the side of me. Oh, okay, I'm sorry. Let's see what we got going on here. There we go. Okay. And make sure that it's locked and in place. And I'm going to take the tubing with me, medication, and the syringe into the room. Okay. Knock, knock.
Come in.
Okay, hello. How are you doing today?
I'm good.
Okay, Ms. Jones, I have to put in, I have to give you your antibiotics from the doctor. I just want to make sure, but before I do that, I have to make sure you are who you are. And can you tell me your birthday?
Mary Jones, 10/20/1950.
Okay, and I am looking at the wristband, and the name and the birthday match. So what I'm going to do is I'm going to go ahead and proceed to start and do the IV. Before I do that, I'm going to touch the antibiotic.
Inject the Herceptin, and it's going to go into the sharps container.
And that's why.
And then I'm just going to.
And before I do all this, I just have to make sure I did write down what was on here, how much is going to be giving, my initials and the time and everything, in which I did that. So I am hanging it.
There's no complaints of pain, there's no tenderness, and there's no.
I am opening this and I am setting this up for the hanging.
Right now.
Okay. So when I do that, I drew up my 6 mLs. I gotta access the site, make sure there's no phlebitis, make sure there's no infiltration, anything going on with that. Just make sure everything is okay. And what I'm gonna do is I'm going to palpate the IV insertion site to make sure that everything is okay. And I am going to clean the port. And then I am going to insert the 3 mLs, making sure that it is unclamped first. And 3 mLs is inserted. Okay, and what I have to do is I have to make sure that I put the date and time on my tubing as well, and that's what I am doing now. Let me grab that. Okay, and of course that would be stuck on there and everything like that. Okay, so now what I want to do is I am going to begin the ASASH procedure, which is the aspirate, the saline, administering, and then heparin if needed. So what I'm going to do is I made sure that nothing was there, and I gently flushed 3 mLs of saline with the push stop method. And now what I'm going to do is I'm going to clamp the IMT. Let's see. Okay. Clean the port. Before I clean the port, I have to apply my gloves. Okay, and I think my other glove walked off, but no problem. Here we go. So with that, now what I'm going to do is I am going to aspirate.
It's only 4 minutes.
Okay, I did that, and what I'm going to do is I'm going to connect this to the needleless port. Okay. The tube is primed, and I'm going to start my drips, which is 17 drips per minute. Okay, and I'm going to watch that, let that go, make sure it's running fine, and it's going to run over 30 minutes. So that is together, and then after that I will come and see and assess it once the antibiotics is done. And right now it's still together, and I'll be back to do the flushing of it.